So in terms of the impact then of breast cancer diagnosis and treatment on the couple relationship, inevitably it places great strain on relationships. And even though many people report that relationships are strengthened as a result of going through breast cancer together, even for those happy couples, there are periods of great strain. Oftentimes too, and even for those of us who feel like we're really in touch with our thoughts and feelings, when you're dealing with feelings associated with being diagnosed with cancer, it's really difficult to acknowledge those thoughts and feelings to yourself. And even if you can acknowledge them to yourself, what we find is often patients and partners avoid talking to their partner about those difficult thoughts and feelings. And that's because often they want to protect their partner. They feel as if they talk about how they're feeling or ask their partner how she's feeling and she becomes upset, then that's the wrong thing, that's a bad thing to do. So I better stay positive, I better not talk about it, I better help to distract her. Now, the other significant factor is sometimes there is a mismatch of coping strategies between the patient and her partner. So it might be that at one point she's wanting to really acknowledge feelings or have a good cry or talk about what's going on, and her partner might be going through a period where he feels he has to cope by keeping busy, distracting himself or thinking positively. And maybe at other times he might be more able to touch feelings or talk about things, but at that particular time it's really, really difficult. And if you have that mismatch of one person wanting to talk or acknowledge or sort of connect with or process emotions and the other person really needing to think positively or distract, or then you can see where there can be a disconnect and distress. Now, in fact, the research shows us that there's no actually one right way to cope with cancer-related challenges. In fact, those people who do better, both partners and patients, are those who have a variety of ways of coping that they can tap into. So, if the patient says, well, my husband's, he's not coping, he's spending too much time, joking about things, or he refuses to talk to me about how he's feeling, you can say, well, listen, there is no one right way to cope. And in fact, it's having a range of coping strategies, a balance of coping strategies, and being able to understand why each of you might be using those coping strategies that's helpful. So just because you're coping differently to your partner doesn't mean that they're wrong, or importantly, that they care for you any less.